All right, hey everybody. We're going to talk about how we're going to use neuromodulator of Botox for Patricia's masseter muscles. So what I want to show you is how we can inject about 10 units of Botox in either masseter muscle to modulate her muscle activity, because she's a pretty heavy grinder even though she's a really small lady. So I'm going to show you how we can identify where we want to inject this Botox in her masseter and how to go about knowing where to place it. So Patricia, if you clench your teeth together. So as she clenches her teeth together, I can feel the band of her masseter muscle all the way here down to the attachment of the muscle. So if I were to put my fingers on the anterior and posterior aspect of it, we want the Botox to be in the posterior segment of that masseter muscle, right in about that area. All right, so the attachment's down here, the posterior aspect is there, the anterior is there, so that's going to be one injection site there. We're going to do the same thing on this side. Oops. I'll have her clench her teeth together. All right, so again, I'll be able to feel the band of her masseter muscle. It's about this thick. I'm going to shoot for the posterior and superior area, so the attachment is down here. So you don't want to do the anterior, because sometimes you hit this risorius muscle there and people can get kind of a Bell's palsy effect. So you want to be careful to not go too far to the anterior. So I've got 10 units of Botox with a really small Comfortox needle. What we're going to be able to do is I'm going to pinch her skin. I'm going to do this very quickly. All right, Pat?
Yeah.
Okay. All right, so that's one. And then we're going to do the same thing on this side. Again, I'm going to avoid the marking because I don't want to tattoo her skin. I'm going to go right in this posterior segment really quickly. So 10 units is a pretty normal dose for, and I'll wipe off this marking for us. So 10 units of Botox is a pretty normal dose for our masseter muscles. You always want to do bilateral. You never want to do just one side because you have an asymmetrical functioning of her masseter muscle. So here's what our goal is going to be. Over the next 4 months, really within the next 10 days, she's going to begin to get the activity benefit of this. But for 4 months, her masseter is not going to be ramming her jaw closed so hard, so it's going to lessen the closing forces and the parafunctional forces that she's putting in her teeth, with the hope of putting less pressure on her teeth and not hurting her dentition. So this is a great treatment for people. It's not the Botox you think, it's not for wrinkles. You know, we can use it in dentistry for some really good stuff to benefit our patients. So if you have any questions, fire them off or email me. I'd be happy to answer them for you. And if you have any interest in knowing how I've learned this, I'd be happy to share that with you too. Hope you all have a good day.